everyone, I'm Dr. Balvin Kaur Ghai. I'm a consultant gynecologist, reproductive medicine specialist, laparoscopic surgeon and cosmetic gynecologist practicing at Mohali. What are the indications of cosmetic gynecology? These are the non-essential treatments or the treatments which are not directly related to the well-being of a patient. So there are very common indications which are rarely discussed. So what are the common indications? Some women may feel that their vagina or the vulva area does not look good. Some patients might feel that there is a lot of laxity in the vaginal wall or the associated area. Some patients might not feel their partner or they might not have satisfaction during intercourse. Another indication for these treatments is urinary incontinence, which is encountered in elderly patients. Another reason could also be, like we discussed earlier, the appearance, like there could be pigmentation on the lower part of the body or around the vagina. We'll discuss the non-surgical treatments today. The most important non-surgical treatment that a patient can do for herself is pelvic floor exercises. These are called as the Kegels exercises. Normally, these involve contraction of the muscles of your floor so that there is increase in the tone, and over a period of time, the deterioration of the problem is reduced. It will not give you 100% treatment, but yes, it will slow down the process of loosening or loss of tone of the vaginal muscles. The next option that the patient has is PRP installation. Now PRP is platelet-rich plasma. This is usually derived from the patient's own blood by centrifugation of the blood to derive the platelets and other growth factors. These growth factors, they help in growing and increasing the tone of the muscles, and in a way they help to regain of the tone. Another option is Botox injections. Botox injections, they act as fillers and they increase the fullness, or like we said, they help in vaginal rejuvenation of the vaginal wall. Botox injections, or what we call as the shots, they can also be given to increase sexual satisfaction, and these are called as the O shot or the G shot. Another form of non-surgical treatment that is available to the patient is in the form of lasers. Now we have various lasers which help to stimulate the vaginal walls, and they help in increasing the tone of the muscles at those particular points. These are also very helpful for patients of urinary incontinence when there is loss or leakage of urine on stress, such as if there is increase in the abdominal pressure, as in coughing, sudden getting up or change in the position, or in sneezing. These also help to increase the tone of the bladder muscles and the walls around the neck of the urethra, and they increase or reduce the incidence of urinary incontinence. Who are the candidates for cosmetic or aesthetic gynecology? Very commonly we come across patients who have had drastic weight loss, or you can say weight loss even over a period of time. As we see that because of the weight loss, we get appearance of stretch marks on the body, around the abdomen, around the thighs. Similarly, there is fat deposition even around the vagina. So when there is loss of this fat, the tissue will lose its you can say the rugosity or the tone. So these are candidates which can be benefited by application or injection of Botox and by PRP installation. Another group of patients who can avail these treatments are patients who have had normal vaginal deliveries. The stretch that the delivering baby brings on the vaginal wall, and that too if you have had multiple vaginal deliveries, increases or stretches your vagina to an extent that in later life the patient will experience, like we discussed, looseness of the vaginal wall, and if you can say there will be loss or less sexual satisfaction. So these patients, they will also encounter prolapse problems in the future because of the loss of the tone. These are also the candidates who can experience urinary incontinence in the future. All these patients can be benefited by using or availing these services.